on the News Channel 5 network. This is MorningLine with Nick Barris.
Good morning, everyone. Thanks for joining us on MorningLine. Nick Barris here on a Monday. Happy President's Day. If you're home today from work or for whatever reason, stay tuned right here. We're going to open up the phone lines. We've got a great topic of conversation because February is National, Heart Month, American Heart Month, shall we say. I think that nicely dovetails with Valentine's Day, which we just enjoyed. And so we like to do this every year. Bring a cardiologist, okay, one of these high-dollar guys that takes some time to come and answer some questions with our viewers and maybe talk about what's the latest on heart health and talk about some of the great programs and things that the American Heart Association is doing as well. So we'll get the phone number up there in a moment if you want to join in the conversation, asking about any number of a broad range of topics on heart health with our guest, Dr. Joshua Beckman. The number's on the screen, and here is the doctor, cardiologist extraordinaire with the Heart and Vascular Institute associated with the fine Vanderbilt University. And on occasion, you will also spend some time assisting with the programs at the American Heart Association here.
So true. I have been a volunteer for the American Heart Association now for more than 20 years. If there's going to be some extra time in my schedule, that is the group of people with whom I want to work.
A very worthy organization.
The most.
Very much. And I know you're here in connection with that. They even gave me some talking points, as if I need talking points to talk about heart health. The good doctor's been on before, and he knows that I pay attention to cardiovascular disease. I'm always asking him questions about these things when he comes on. And there's a lot to touch on. I'm just wondering, year to year, Doc, and obviously you've been a cardiologist for some time, do things change much? I mean, and when I mean that, you can choose where to go, from treatments to the number of victims to what we see happening in heart health.
So I would say there's changes on every front.
Okay.
There's no limit to what's been going on. In the first decade of this century, we were making really great progress, and the number of people dying from heart-related diseases was declining. But actually, with some of the changes in behavior and some of the new things that have come along, like vaping and things like that, we're actually not making the same progress we were. In that same time, though, there's been a bunch of new medications that have been approved, and I think there's been even more public awareness that some of the behaviors and things that will make us healthy, obviously avoiding smoking, but much more focus on trying to get your blood pressure under control. There's some better medications for cholesterol if needed. So I would say that there's both positive and negative things that are going on at this point.
It's interesting. One of the stats that they gave me from the Heart Association to bring up with you was that 58% of those surveyed do nothing to address their heart health. Meaning they're probably going through days just feeling fine and they do nothing.
You know, I don't want to undersell the amount of time and effort it is required to get up in the morning, make sure your kids are ready for school, get to work, go to work, come home, and then have some time to figure out how you're going to have more heart healthy behaviors. I think what it really shows is we have to help people out with some public policy things. And we then also have to say, look, you know, it is difficult on a day-to-day basis. You have to kind of plan how things are going to go, whether it's shopping for the week or it's trying to figure out how to get in a little bit of exercise. But I completely understand what it's like when you're working full-time and you have kids at home. It's difficult.
Have you ever held a human heart in your hands?
On more than one occasion.
Okay, in the open chest of a patient?
On more than one occasion.
And was it beating at that time, or was it kind of being...
So it was being slowed down so that they can operate, so they could operate on it, yes.
Does it feel like a little squishy ball?
It feels like, it actually sort of feels like your arm muscle, because it's muscle.
Oh, okay. So it's
just not when you're flexing, because it's obviously stopped.
Okay, and you can squeeze it?
Yeah, because there's chambers in it that hold blood, and they're not being filled or emptied at the time.
Gosh, that's amazing.
And actually, one of the times I was doing it, I was hugging the back of the surgeon like this for 3 hours.
Because you were assisting, or?
I was a medical student at the time, and I was assisting, although I'm not really sure assisting is the right word. I was more
observing, learning?
Well, I was basically had my face to his back for 3 hours.
Okay, but your hands were around
My
front
hands
and
were
holding
around
onto the
him,
heart.
holding the heart, yes.
Holy cow. All right, so as a cardiologist then, I mean, there are cardiac surgeons, right? You are
I'm a cardiologist. I don't cut people open.
Okay, but you've had your hand in someone's chest.
Multiple times.
And can you tell by looking in the heart if there is, just by looking at it when it's cut open, if there's too much fat on it or if it's not healthy or whatever?
No, you can see people who generally need a heart operation, say for bypass because they have blockages, they have more fat on their heart. You can see it.
Can you go in there and just slice that off?
You can. It doesn't make the heart healthier.
Oh, it doesn't? Okay.
No, in the same way that liposuction doesn't make you healthier either.
I see. It's what makes you healthier is a lifestyle change, and slowly over time. The quick fixes don't really work. There's not a magic pill that's going to, well, as close to a magic pill there is in terms of cholesterol. I'm not on a statin drug, and we'll debate that later, even though I have elevated cholesterol. But Crestor dropped my cholesterol significantly in a matter of days.
Yeah.
That stuff works.
No, those medications are like magic, and I think they are responsible for some of the most impressive gains we've had in the last 25 years.
But you would not recommend a statin for someone who has normal cholesterol just to maintain, or would you?
You know, it kind of depends. If you have diabetes and you have normal cholesterol, I would recommend a statin. If you somehow had normal cholesterol and you had heart disease, I would recommend a statin. If you were 40 years old and you had normal cholesterol, and I could say, now is the time to do a bit more exercise and try and avoid some, say, hot chicken, then no, I would not. I'd rather start with improving your behavior and your diet so we don't have to put you on a medicine.
Well, that's the way I look at it, okay?
Yeah.
I mean, if an individual has elevated cholesterol, and we can talk about LDL, HDL, total cholesterol. What do you look at these days, by the way, with cholesterol checking?
So I look at all the different parameters. The LDL is the cholesterol that we generally treat towards. That's the bad cholesterol, LDL cholesterol. And we would like it ideally to be under 100.
Okay.
Most people kind of live somewhere between the 100 and 150 range. The HDL is a good cholesterol, and we want that one over 40 for men and over 50 for women.
Triglycerides matter?
Triglycerides do matter. I would say they're in a solid number 3 position compared to the other two, but they're important as well. And they tend to go in opposite directions with HDL. So higher triglycerides, lower HDL. So commonly bringing them down also helps bring up the HDL.
Interesting. All right. And so you look at that more than you do what we used to hear, total cholesterol. I mean, you could have like a 210 or 240 total cholesterol, but your LDL HDL ratio is maybe what doctors look at more.
The thing I think we're looking at most now is called non-HDL cholesterol. So that's the total cholesterol minus the HDL, and that number sort of gives you a nice summary of the whole cholesterol situation.
Okay. And what's the number you want to be under?
You would like to be under 130.
For that. Now, that's not total cholesterol, right? Or
correct. That's non-HDL cholesterol.
Okay, non-HDL. Total cholesterol, still they throw that number out sometimes. I get that. And they say, well, Nick, you're at, at one point I was 290. I addressed my diet. I went down to 240. Then I went on Crestor for a while and went to 140. I said, I don't want to take pills the rest of my life. So I thought I'll just battle it with diet and exercise.
Did it work?
Yeah, I'm still elevated, but I have no other risk factors but cholesterol, and I'm not going to take a pill the rest of my life.
You will eventually.
No, I won't.
Okay.
I'm not going to do it.
Okay, I'm not going to make you do it. My job is not to twist your arm.
No, but why should I?
My job is to lead you to water.
Who wants to take pills? Taking a pill, I mean, there are side effects with statins.
Rarely.
Have you ever had a high liver count, my friend?
I have not.
Okay, lucky you. Have you ever had memory loss or perhaps muscle aches?
Every time I'm tired.
All right, but statins, I do know, make a huge difference. I've had friends of mine that have very high elevated statin or cholesterol, and it's made a difference. Probably kept them from having heart attacks.
Oh, it clearly reduces your cardiac risk. Every single person that takes it.
No question about it.
No.
Yeah.
I'm telling you, it's the most important single medication since I graduated from medical school.
That's a big deal, and there have been a lot.
And I'm old, so there's a lot of them.
What are you, 38, 39? All right, so no,
I
don't
can't
answer
hug you on the air, but yes, sure.
All right, we'll take a break. When we come back, we've got some phone calls for you. If you have a question for our cardiologist about your heart health in general, some of the things we're touching on, boy, this guy knows his stuff. He's terrific, and he's great at answering it. And he's really very friendly because he tolerates me. The number, 737-7587 is the number. We'll be back with your calls and more with our fine guest, Dr. Beckman, not from Ghostbusters, but from Vanderbilt, right after this. And we're back.